Hey, Mbuluvinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Davilati. A massive thank you to everyone that have been following our social media pages, and especially right here on our YouTube channel. Massive thanks for the subscriptions, the likes, and the follows. Vinaka Pakalevu. Today with us in studio, we have none other than our very own interventional cardiologist here at Oceania Hospitals, Dr. Rakesh Mbuluvinaka. Doc, welcome to the show.
Thank you, Alex.
Thank you for joining us on Health Talk with Oceania Hospitals. Just to begin, could you please introduce yourself and tell our viewers and our listeners a bit about your background and your role as a specialist interventional cardiologist?
Bula Vinaka, Namaste, good morning. I'm Dr. Rakesh Adhikari. I've been working as an interventional cardiologist for the past 9 years. Initially, for 2 years, I worked in Lahore, Pakistan, from where I did my graduation and post-graduation. For the last 7 years, I was working at the largest cardiac center of Nepal, Shahid Gangalal National Heart Center. And since the beginning of this year, so I've taken charge of the cath lab at Oceania Hospitals to serve the people of Fiji and the Pacific region. And my expertise is interventional cardiology, and I do coronary interventions, pacemaker implantations, peripheral intervention, and also structural interventions. However, I'm more focused on coronary interventions.
Thank you. Can you please explain what interventional cardiology is and how it differs from other branches of cardiology?
Yes. Intervention cardiologist is firstly, he is also a cardiovascular physician, okay? So basically, I'm also initially a cardiovascular physician. I treat all the cardiovascular disorders. And being an interventional cardiologist, I'm also supposed to do interventions, coronary interventions at the cath lab. And also besides coronary, there are other interventions such as pacemaker implantations, and there are structural interventions, there are peripheral interventions. So intervention cardiologists, they do interventions, whereas the cardiovascular physician, they only treat the cardiovascular disorders. So that is the main difference.
Thank you, Doc. What are some of the most common heart conditions you see in your practice, that you've seen in your practice, and what symptoms should people be especially vigilant about?
Yeah, it's a very good question, people can have, they can have chest pain. It can be perceived as some tightness, some burning sensation in the chest, and sometimes it radiates to left arm, sometimes maybe right arm, sometimes to the shoulders, and sometimes even the pain, when patient does some work or works uphill, the pain can go up to the jaws as well, Sometimes there is burning sensation or discomfort in this region, epigastrium, and people mistake it for gastritis, and sometimes they don't go seek medical advice. So, and also patients also can have some breathing difficulty, they can feel short of breath on exertion when they walk, when they go uphill or upstairs, and when they take rest, it's normal. So these are the signs of, heart attack. And also heart attack can lead to heart failure, and the shortness of breath also could be the signs of heart failure as well. And also other symptoms are also there, like besides heart attack and heart failure, there could be other disorders, like there can be rheumatic heart disease, people can have recurrent sore throat, tonsillitis every year, after every 2-3 months. So we have to screen it with echocardiography to look for any rheumatic heart disease and start the therapy, penicillin. So it can be oral, or it can be, we can give injections, okay? And in some families, like there is a history of sudden cardiac death in young people. So in that case, there can be some cardiomyopathies, okay? Those disorders can be running in the family. So we have to screen all the family members with echocardiography, and other symptoms also. Patient can have palpitations, patient can have syncope, there can be blackouts, and these can be signs of some heart rhythm disorders, which also we have to evaluate with Holter monitoring, echocardiography, and other tests, So there can be tachyarrhythmia, there can be bradyarrhythmia, heart blocks. Sometimes they warrant some pacemaker implantations. Okay, so these are the basic symptoms. So the main thing is, whenever you have any sort of chest discomfort, it can be vague. In females and in diabetics, they may not have chest pain at all, or they can be only, there can be only mild shortness of breath. It could be a sign of heart attack. So it's better to go to hospital and then just rule out there is no cardiac problem than to stay at home and then just think it as a gastritis, and it could be a fatal heart attack.
Thank you. That's a perfect segue to dive into the services that's provided here by yourself and the team here. Could you briefly describe
at our hospital, regarding the interventions, we have a very well-equipped cath lab. So we do coronary angiography. Okay, so coronary angiography means we check whether there is any block in the arteries of the heart. And we do coronary angioplasty. Mostly people call it stenting. So most of the time we put stents. Sometimes we can get away without putting stents, just with the balloon. So it is coronary angioplasty. It means opening of the blocked arteries. Okay. So in simple terms, it is like plumbing the heart. When there is block in the pipe, you just open it up. And there are some other emergency procedures which we provide here. Like somebody coming with heart block, we do temporary pacemaker implantation. And also there is another procedure, pericardiocentesis. It is an emergency procedure when heart is engulfed with fluid all over, so we have to drain it out. Okay, so and regarding diagnostic modalities, we have ECG, we have echocardiography, transthoracic, transesophageal, we have stress test. Okay. Those are like stress ECG test. Commonly it is called TMT, treadmill test. We have stress echo cardiography as well, and we have cardiac CT, we have CT coronary angiography, we have cardiac MRI, and we do Holter monitoring. Holter monitoring is to monitor for the rhythms of the heart. So these are all the facilities, and we treat all the heart disorders. And it is like high blood pressure, high cholesterol level, rheumatic heart disease, heart failure, cardiomyopathies, heart attack, and these and the coronary procedures which I just mentioned, angioplasty and angiography. We do it for those patients which we diagnose ourselves at our hospital, those who are admitted or on outpatient basis. And also we get multiple referrals from all over the country, and also out of country as well for the intervention procedures, coronary angiographies, angioplasties. So we have been providing these services.
Thank you very much. Finally, just one last question. What key lifestyle habits or preventative steps would you recommend to help reduce the risk of cardiovascular disease, especially within our Pacific communities?
Yeah, so this is very vital question, There is American Heart Association has mentioned, life's essential 8. Okay, it means no smoking, there should be good physical activity, healthy body, weight, healthy diet, healthy sleep. Sleep should be adequate. And we have to decrease the cholesterol level, we have to decrease the blood pressure, and we have to control our sugar levels. So if we control these 8 things, so there is very less likelihood of getting cardiovascular disorders. So we should improve on our diet, and there should be, regarding physical activity, there should be 30 to 45 minutes a day. Okay, it should be almost 5 days a week is enough, so we should more focus on a good diet and healthy activity, we should move away from the sedentary lifestyle, which mostly people during COVID, they stayed indoors, but now you have to go out and then do physical activities,
Thank you very much, Dr. Well, there you have it, ladies and gentlemen. Word of advice from an interventional cardiologist, especially in terms of the services we provide here at Oceania hospitals, and also lifestyle habits to keep your cardiovascular health up to par. And remember, no smoking. Love your heart. So from us here at Oceania hospitals, till next time, Vinaka Vakalim.